past. And today's meet, we have with us Dr. Dayal Mirchandani. He's a senior psychiatrist and he's been practicing hypnotherapy since 1980s. And he has also been in board of various universities, Mumbai University, which is now known as Tata Institute of Social Sciences, SNDT. And Sir is also guiding us in Academy of Hypnosis. He is one of the esteemed advisory board of AoH. We welcome you, sir. And today's session is going to be a kind of question answer format. So we have a couple of questions, and I'm sure if other participants have their question, they can put it in chat box. And once the session with Sir is over, we can take some more questions from the audience. So, Sir, I was interested in knowing.
Okay, first thing is thank you for inviting me and for all the people who, despite the match, have made it. Okay,
Thank you, sir. Yeah. So, there is a common question that comes like, what are the things in which hypnotherapy can help us, and particularly the psychological problems that today's young generation is facing, and there is an alarming rise in suicide cases, be it in Kota or in other places. So, can hypnotherapy-based therapies actually be useful in such scenarios as well?
Sure. See, the thing is that hypnosis is not a therapy as such, it's a modality. That means we can use many different therapies with hypnosis. And hypnosis probably predated most of the current therapies. Freud first learned hypnosis from Charcot and others in Paris. And before that, Janet and a whole lot of other people were doing hypnotherapy. It predates even NLP, whole lot. So we can definitely use hypnosis with all kind of health issues, whether adolescents, mental health, physical health, all those things. So we can talk about that. So let's talk about adolescents. The common problems nowadays are screen addiction, games. Definitely hypnosis is a very useful method. There's some guidebooks and other things. I can share the names later because I don't want to get stuck on one thing. But Zeke Tucker has also, that's Dr. Zeig's Press has also published one which is about 400 rupees on Amazon. So it's called The Inner Selfie, but there are many others. So that's one area which you can use hypnosis. The other area that common with adolescence is study problems, motivation, being able to focus, sleep issues because of anxiety, exam panics. All of these, to my mind, there's no other therapy that is as good as hypnosis for controlling anxiety. So whether it be a panic attack, you can terminate a panic attack in a short while with hypnosis. Maybe as fast as with a injectable. If if you work with a patient with an instant induction kind of thing. It also works well with, you can train people for examination panics. If you look at the collected works of Milton Erickson, you'll find his papers on medical students, lawyers, other people who had examination panics or who not even been able to go multiple times. And then he just taught them hypnotic without even suggesting anything. He's taught them various hypnotic things like time distortion, making the examiner look as if he's talking from far away, all kinds of modalities he's used to be able to, he just taught people how to use that so that when they need it, they are able to use those resources. The normal kind of hypnotic ways of changing and perception and perceiving things differently. So you can definitely teach patients. It's possible to teach people to focus better with hypnosis, to move out distractions and adjust. You something like suggestions about working in a factory or living next to a bus stop. So you teach them how to screen out, how they can get used to disturbances. And I had once, when my son was studying for an exam, there was construction happening nearby, and he was getting quite irritated. I'd given him noise cancelling headphones, and he just learned how to screen that out and get used to it. So it's possible to do it both with hypnosis, with an inner trance, or even with waking hypnotic suggestions. David Walk has published papers on waking hypnosis, how to induce it, and those kind of things. So definitely it's very useful. Focusing on studies, being motivated. And the advantage of hypnosis is, when you deal with adolescents, often they don't want to talk to you, or they're resentful about, they, why should I problem with the net, I
Yes.
think.
Yeah.
Okay, so I was talking about, so just learning issues right from an early age. One can use hypnotherapy from 4, 5 onwards. So cases that have been marked as ADD, ADHD often have anxiety more than anything else, and it's possible to work with them and help. And then stress is a major problem often. So one can teach self hypnosis, and one can teach them time distortion and other techniques, so that you can't expect children and adolescents to sit for more than a few minutes. So to teach them, deep relaxation, and then with time distortion, you can help them do better in their studies, and it reduces stress, improves their sleep quality, all those kind of things. You can do groups, motivate them to study and to avoid. So let's move on to the next.
Yes, sir. We covered how with young students and adolescents we can use hypnosis. So how about adult population? Because these days even adult population is facing a lot of stress, and chronic cases of chronic illness and chronic pain are also increasing day by day. So how can hypnosis be useful in these cases?
See, I mean, there are with adults, there are two areas of use. One is to improve performance, to get more focused, to be more motivated, all those kinds. And you can also use it for psychological issues, so all kinds of anxiety and depression and those kind of issues. You can also use it for chronic pain and a whole lot of psychosomatic issues. We don't even call them psychosomatic, now we call them psychophysiological. Now we know that people with chronic illnesses like rheumatoid arthritis, with asthma, with skin conditions, because of the itching and because of the discomfort that they feel because of all that, there's a higher incidence of depression, anxiety, and all kinds of psychopathology among them. And that's very often not addressed, or if the GP you go to or something, he'll give you a SSRI or some benzodiazepine, both of which are now known to be fairly addictive, and they're not indicated for, say, IBS or asthma, or they're indicated for depression and anxiety maybe, but not for these things. But just because they think there's stress, so goli de do, but it doesn't address the stress. So if you with hypnosis, they are up. I mean, Mayor Luhan in the 50s, he's published papers, was getting up to 70% results of markedly improved cases. So So you can, know that people have used it and help people overcome all kinds of psychosomatic migraine. Uh, Migraine, no, they are not necessarily psychosomatic, they're psychophysiological, made worse by stress. But often, even these diseases are or disorders are well treated with hypnosis. So you can reduce the morbidity and the suffering that people experience. Also, with cancer patients. Dr. David Spiegel used to run a cancer group for people, women with breast cancer. I don't remember many years ago I read his manual for that. But the longevity of the women who were in that group, it was hypnosis and group discussions, it nearly doubled the survival rates. Maybe one or two people had regressions of their cancer, but it reduced suffering, it reduced depression, anxiety, all those things which people, and what people often forget is that when someone has a chronic illness, there are other people in the family who are also affected. The spouse, the children, the so often one needs to ask about them, their well-being, and one can use hypnosis with them to help them support their person who's going through a difficult illness. So things like the ways there are multiple ways, but I'll just give you a few examples. Mayor Luyan used a method called guided affective imagery, which is basically teaching people how to go into a structured imagery thing and then dream, exploring that meadow and going into the stream and those kind of things. But just tell them to dream that they were in this area doing different things, and he would give ego strengthening suggestions and suggest this as a first step. If the person didn't improve, then the second step, he'd have them admitted for 2 weeks and have them in the hospital do it for multiple hours while they were in the hospital. He was in Britain in the NHS, and he got excellent results. So whether all kinds of chronic So I had done a study with a few patients in the early 80s. Today it's impossible to do it because no one will spend so many hours a day doing self hypnosis. But the idea was that the person does self hypnosis for those 4-5 hours a day, and then reports back to the therapist for 5-10 minutes to just be motivated and to explain the blocks. So, for example, that method, the Sakido also used dreams. So there were various methods of dealing with psychosomatic illnesses, psychophysiological illnesses, which you can read about. So it definitely helps. Then with phobias and all, airplane phobias, medical phobias, I've treated people with dental phobias. Their teeth are in horrible condition. They refuse to go to a dentist. I've treated people who needle phobias. They refuse injections. People who don't go to a hospital because of that. People who have got lots of people with MRI and CT scan phobias. So if you are friends with a radiologist or there's forgotten the name of this person, but she's just working. She's a radiologist, ex-radiologist. She's teaching radiologists and others how to just help you people using hypnosis to get over their fears of phobias to these procedures, radiation and what's it called, MRIs and all that. So there are multiple places you can use hypnosis. And then for chronic pain, there's nothing better again, because all the medicines are highly addictive. Gabapentin, pregabalin, all these medicines, and they give partial relief. They don't give the kind of relief that hypnosis can give. And even with there are a number of books and things on using it with cancer patients for helping them deal with their discomfort, the fear of death. So it improves their quality of life. It won't cure them. but there was a hypnotherapist. I don't know if you've heard of Anselm Mears. He was Australian hypnotherapist. He switched from hypnotherapy to teaching uh, patients very deep meditative, how to get into very deep meditative states. From hypnosis, he learned those techniques, but then without that, so he'd have a group of patients, and many of his patients lived far beyond what they were expected to, and few of them had regressions where the cancer disappeared. But that, research was never followed up because it wasn't researched as such. It was one person doing this and writing about it and being ridiculed because doctors couldn't believe that this is possible. But his book is available. I can give you the references later if anyone's interested. Anselm Mears. Any others? Okay, should we move to something else? So
Yes.
one sec. Let's go to depression. Yapko has written books on how to treat depression with hypnosis. So you can learn how to. The anxiety, you don't really need books because it works. You can use multiple techniques. Phobias, airplane phobias, all those things you can. There are multiple techniques that can be used. Any other questions you have regarding adults where we can use?
Yes, related to adult, apart from these kind of issues, there are a lot of relationship and interpersonal issues, marital issues, sexual problems coming up. So, can hypnosis model also be applied here?
Okay, so there are people who have written about this. So there's one book called The Couples Hypnotic Game, where they use hypnosis in couple therapy. You might have heard of therapy called IFS, which is
Yes.
very similar to parts work
Yeah,
or
internal
to
family.
ego state therapy. So they have also written books on how to use IFS with couples. Uh, Richard Schwartz. And then there's Michelle Ritterman, who has written a book on hypnosis with family therapy. All of these are available for about 500 rupees on Kindle, from published by Z Tucker. So someone interested can, so it definitely helps. Now, as far as sexual disorders are concerned, that's a major use of hypnosis. Low sex drive, again, you try medicine, they don't really work. Often they are to do with subconscious issues. And for both male and female. So sometimes it has to do with some kind of abuse in the past, or sometimes there's some guilt, or there's some other thing coming in the way. So you can use hypnoanalysis to find out the cause, and you can also use hypnosis to enhance sexual feelings and desire. So there's a whole lot of books on erotic hypnosis, written mainly by lay people, lay hypnotherapists, but it works really well. Then for men, erectile dysfunction, it can be organic. That means there's a physiological reason for it, like there's not enough blood reaching the penis and all. So those the people with that kind of condition will respond to drugs like Viagra and all. But people with a psychological, despite the Viagra, they might not. They'll get all the tests come negative, and they'll maybe get an erection with Viagra, but the moment they try to have sex, they lose their erection. So those are the kind of patients where there are subconscious issues, which you can either using ego state therapy, or I use idiomotor signaling, Dabney Evans method, to get to the source of the issue, resolve that, get insight, and then maybe reteach them how to have, using sensate focusing, which is a method of learning how to get back, first pleasuring each other non-genitally, and then gradually getting back to being able to have sexual, like penetrative sex. So that's That's with males. With females, vaginismus is a common issue. That means one sometimes it's primary, where the moment the woman tries to have sex or there's any kind of penetration, medical or even if the person tries to put a finger, insert a finger. Okay, I've lost.
Yeah.
So you're audible, sir.
Yeah. So there is that. It can be used for that primary, and secondary is if there's some marital conflict, or sometimes post a medical condition there's pain, and then because of pain that protective. So there's a whole lot of sexual disorders, and apart from that, one can use it to enhance the quality of sex, even if there's no sex disorder. So many of the erotic hypnotic teachers and all, they have workshops, so they do teach individuals how to improve on their sexual functioning. And that there seems to be an interest in that, because there are courses and there are books and there are a whole lot of things happening. But I don't know anyone in India who's doing. So that's it. But you should stay within your scope of practice. So if you're a doctor, then you deal with. But if you're a psychologist, if you've been trained in dealing with sexual issues psychologically, whether you first send the person to a urologist or a gynecologist, and then do a then treat under the guidance of a medical specialist on that. So that's another area, and I'm getting a lot of people for all kinds of people with performance anxieties at work. They're not able to do presentations properly, social anxieties of some sort, uh, patients who have to adapt to various kinds of conditions. I have one patient, for example, whose boss sits in America. So when he's sleeping, the boss will call anytime. I guess he wouldn't do that in America with his juniors. But since there's a time difference, he'll call him in the middle of the night. So that's totally disrupted his sleep. And he'll be worrying, will he call tonight? Will he not call? Then after he calls, he'll be angry, and so we've worked with that and taught him how to, just talk to him and go back to sleep, because he's working for a multinational, but he doesn't want to. He's very highly paid, but doesn't want to lose his job. So all kinds of issues, social, people who are in group discussions, they can't talk, people who want to become more outgoing, have better leadership skills. So many of them come for therapy now, or seeking out therapy for this. And this is often a word of mouth kind of, you have someone, he sends his juniors and those kind of things. So, but people are looking for coaching, people are looking for how to become more effective. There's a lay hypnotherapist called Anthony Gailey. He does hypnotic lectures. He's nearly retired now, but he charges a lot. But companies call him to come and give a demonstration, and in that demonstration he builds in suggestions for, you'll find him on YouTube, suggestions for being more effective, being more all kinds of suggestions that the company needs, being more proactive to go out and sell and those kind of things. So whether they are lay hypnotherapists or not, hypnosis is being used. I think we need to take it back from the lay hypnotists.
Exactly. So there is one more question. There is a field, gender dysphoria. Usually in India, we had few cases earlier, but nowadays there are a lot of issues of LGBT and trans community specific issues. So what can be the use of hypnosis
So
with this?
one is that often people are confused. Am I gay? So there's something called sexual fluidity. That means especially youngsters now experiment with both sexes, and they have sexual experiences. They don't know what is their. So we can't treat. It's absolutely wrong to try and convert someone. It's illegal also. You can go to jail for doing that. So we can't treat anyone with hypnosis, and there's no evidence to show that it's ever been useful for converting someone who's gay, homosexual to what is people think is normal or something. So, but there's a lot of shame. There's a lot of discomfort. There's a lot of am I gay? Am I able? I can have sex with a woman. I can have sex with a man now. What do I? What am I? So often I would suggest that they get into a trance and then, talk to a wise part inside and come to their own conclusions, or see themselves 5 years from now, and, future orientation in time, then look back and see how they've handled that difficulty. So there are different ways of, so that's one issue. Then the other issue is the shame. How do you help them feel good about themselves and deal with the shame? These are the kind of issues. They also have sexual issues more than any other, because especially trans people, they've had surgeries and other things with their genitals are not the same as, like say a woman who has become a man, a trans man will not necessarily, there is some kind of reconstructive surgery, but that's not the same as, so we can help them to adjust and adapt to that. And the shame, the discomfort, and there's something called feminization. That means the man wants to become a woman. We can use hypnosis for feminization therapy. That means to talk little more like, and have learn using techniques, to become, imagine themselves as a woman and see themselves going into their own body as a woman, and take on more feminine attributes. And similarly, for a trans man, that means someone who's transitioned to being a man, we can work with that, like taking on more masculine gestures and ways of standing and those kind of things. And then we can work with detransitioning. You might have heard of this. I've only seen one case where people have got a transition and then they regret it. So they realize their life is, they made a mistake maybe. So I had someone who was 16 or 17, then soon as he was 18, went to some foreign country, and some in the Southeast Asia had surgery. Luckily only upper surgery, and then realized it was a mistake. So, the whole anger and upset and the whole coming to terms with that. So these are some of the issues that can be, but one needs to make sure that you're comfortable dealing with people who have a different orientation, and you're not judgmental and all that when you're doing therapy with gay and lesbian people. So it's good to do a little bit of training or reading they'll catch on within 5 minutes that you're not, that you're judgmental. And they are very, because it's a community kind of, they also have lists of doctors and therapists and those kind of who. I don't know am I visible, or can you hear me?
Yes.
Yes, sir, you are visual and audible as well.
Okay. So there's a lot of work that can be done, and there's a scope for someone even specializing in that, working with LGBT clients and training people on how to work with LGBT clients. Okay, should we go on to the next one, Nidhi?
Yeah, so we have few questions on the chat box.
Okay.
Tejvi sir, but I'm not able to see these questions.
जी.
So there were at least two questions. There was a question regarding time distortion technique, which you discussed that we can use with people who are, internet addiction or examination anxiety. So there was a question
Not
regarding
so
that.
much for internet addiction, but for stress management.
Right.
So
I'll reframe my question, sir. It was regarding the application of time distortion in various areas, the application areas of that. Because it's a wonderful concept which has been utilized very less.
yeah, so all the hypnotic phenomena, the first area that I use it is for, the person needs to believe they're in a trance. When you come out of a trance and it seems like you're out in 5 minutes, when you look at your watch, it's 20 minutes or half an hour. That's the first, like convincer that, yeah, I was in hypnosis. So that's one place I use. So I try and use a hypnotic phenomena in every session if I can. And even in a first session where I keep 10-15 minutes, maybe because of the intake, I try and bring in a hypnotic phenomena if possible. So time distortion is one of them. I'll notice what time the person's gone into a trance, and then I'll ask them how long do they feel they've been in a trance. If he says 5 minutes, 3 minutes, and it's been 10 minutes, then I said, actually it was 10 minutes. So that's one as a convincer. The other use of time distortion is for like dreaming. Just like you can dream about months and years, so you can see yourself doing various things. So, but for the purpose of stress management, I just tell them to imagine that they've gone into a trance and then maybe 5 minutes and then expand time so that it seems like they've been in a trance. I mean, they've been relaxed, deeply relaxed, profoundly relaxed for an hour or so. Well, actually, they've done 5 minutes or 10 minutes. And the relaxation can be any technique that they're already familiar with also. So one of my patients was a Vipassana. He had done 10 days and all, but they wanted him to do an hour or two every day after that to follow up. He couldn't do it, but he enjoyed that. So then I just taught him time distortion and told him, okay, you do you decide, you give yourself a written suggestion before you go in that I'll come out of this in so much time. And during that time, I'll be doing my Vipassana. And Vipassana might not agree with this technique, but it was useful for him. So, and then you can use time distortion for pain. So you can imagine that if it's, say, if it's episodic pain, you can shrink time. So it seems that it's over in a flash. It's been only there for a few minutes. If it's you can expand comfort to spread for longer periods. So things like that. So there are many uses for time distortion. If anyone wants a reference, I have a book. I forgot. EDGETT is the name of the author on how to use hypnotic phenomena in hypnosis. So it's available on Amazon, I think.
So if you permit, we can take one last question.
Sure.
So somebody, Shikha Mohan has asked, how do you work with a person who is hard of hearing?
I've not really done that. I've only worked with people with hearing aids and all. But I guess what one can do is to use electronic hypnosis. That means you get yourself headphones for the person and then use through some device, a laptop or something, turn up the volume till the person can hear you, and then give your suggestions through that device and see if it works. But I've not personally done that, but I've seen people who do group hypnosis that way. They give everyone, what do you call it, headphones to wear, and then the person talks in a microphone. So it should be possible with a person who's hard of hearing. And I know many, I've had one case of a hard of hearing person whose family brought her to me to convince her to start wearing a, what do you call it, hearing aid, but she never came back. She was angry about the whole thing because it was deception.
Okay.
So, the other place I just want to mention briefly where hypnosis works very well is with young children, infants. For example, with issues like asthma, with physical issues, crying a lot. Often they're not bonded well with their mother because of some complication during pregnancy. So that's one thing, or because the mother is suffering from depression or some other issue. And when you treat the mother for that, the maternal infant bond is repaired, and the child starts behaving better. So there's Antonio, what is his name? I'll send you the link if anyone's interested. And the other area that there's a huge demand is painless childbirth. Dr. Cheek, for example, found that patients, once he learned how to deal with, apart from painless childbirth, he was able to talk to the child and get them to turn around. And once you remove all the anxieties the mother has about children, so he said that in his last, I heard his lecture, I think I've shared it with you, or with someone I've shared.
Audio quality was a little low, but you did.
It's very low, it's very old, but he was able to turn around the infant so that normally it's 4% of infants are born facing breech delivery. That means the back is coming on instead of the head. He was able, not one of his last 250 cases had a breech. He should have had 8, but he was able to communicate with the infant and get them to turn around using hypnosis. So these are the kind of things that are achievable with hypnosis, but unfortunately, someone is doing it and then it's lost. Yeah, so painless childbirth or pain-free childbirth is you had a lecture, I haven't heard that one, but that's one big area where you can market yourself and have clients come. So, and Dr. Cheek felt, Dr. Dabney felt that many children, you'll find that families seem to be okay. Three children okay, one child is not okay, he's got behavioral issues or ADHD or something. You do a regression back to birth, you'll find that there's some complication during the pregnancy. And once you have that child go through that again, imagine that they're having a normal kind of pleasant birth. That's the adult or the child who's adolescent or whatever, that issue sort of gets resolved. So, and Dr. Dabney says that when he first heard about regressions to birth, he thought it was rubbish. How can you, and the child doesn't neurologically not prepared to understand or remember those things. And even I used to think like that, but when I heard these lectures and tried it with patients, it seems to work.
Amazing, sir. Amazing.
Yeah.
I think this is the area for, I think Dr. Rakesh Jain would also be able to tell us something, because womb healing, when he does regression, so he has also taught many of us the womb healing is a place where we need to really look into, and many of the issues, as you rightly said, happen in the lifetime of a person because of the state the child was in the womb of the mother. And through regression, those things can be addressed. Yeah,
Yeah,
Dr.
and
Jain
you
would
can
be able
use
to tell.
hypnosis also for diagnosis of conversion disorders. That means things like chronic pain, paralysis, epilepsy, which have got no physical cause, but they are psychological. And you can also use it for asking, is the issue in this year, this year, this year, is it in the womb, is it pre-life, is it? So, it's a diagnostic use of hypnosis also. Now I use finger signals for that.
Okay. Okay.
I don't want to go over time, so I'm
Uh,
cutting it short.
It was an amazing conversation, sir. I'm sure our audience have learned so many new things and scope of hypnosis. Thank you so much, sir, for your valuable time.
Thank you, Dr.
Okay,
Dayal.
thank you.
Wonderful.
Thank you so much.
Okay.